Welcome to the Tougaloo Central Mississippi Area Health Education Center Community Health Worker Training Program, sponsored by the W.K. Kellogg Foundation. First of all, what are community health workers, or CHWs for short? The definition given by the American Public Health Association is frontline public health workers who are trusted community members or who have an unusually close understanding of the community that they service. Community health workers are also known by many titles, anything from outreach, peer health, or lay health advocates to community health representatives, advocates, or educators. Now, what actually do community health workers do? A community health worker can perform outreach, advocacy, or mobilization services, serve as a cultural liaison, or provide home health-based services or social support. They can address health education, promotion, or prevention. Community health workers can help navigate health systems such as with cancer or healthcare insurance access. Community health workers serve as a healthcare team member. Community health workers are engaged at both the clinical, serving as a bridge or liaison, or the community level, where they serve as a point of contact for community resources. The patient is essentially at the center of care, ergo, the patient-centered care system. Community health workers have a positive impact on healthcare by improving the overall quality of care that the patient receives. At the community level, community health workers impact access to quality of care, which in turn improves the health of the community and the individual. This leads to reduced costs for both the individual and the healthcare system. Community health workers have a positive impact on healthcare by improving the overall quality of care that the patient receives. At the community level, access to health care is impacted by community health workers, which in turn improve the health of both the individual and the community. This leads to reduced costs for both the individual and the healthcare system. At the clinical level, CHWs enhance patient compliance, which leads to decreased visits to both the doctor and the emergency room, as well as the hospital. The patient becomes empowered and better health outcomes are realized. Community health workers work in a variety of settings, from the hospital to home-based faith agencies, nonprofits, community health centers, as well as in research public health institutes. The training to become a community health worker involves learning core competencies. The Tougaloo Central Mississippi Area Health Education Center is one such facility that can provide training. They provide tools of both knowledge and skill. A certificate is given linking both the learning to employment. In Mississippi, community health workers build capacity, which enhances the workforce healthcare team. This serves to reduce disparities or uncovered areas of healthcare, which we call gaps. Community health workers can provide direct care, serve as interventionists, or in prevention. In Mississippi, community health workers work in both rural and urban locales. Their focus may involve chronic disease like diabetes and hypertension, child health like asthma, address obesity issues such as diet and exercise, work in addictive diseases such as tobacco and mental wellness, provide both health education as well as promotion, and serve to impact healthcare access to insurance. While majority agencies do not reimburse, some do, like Medicaid, Medicare, and private health insurance. In Mississippi, there are organizations that use community health workers. 78% of these are nonprofits, while 75% utilize both a combination of paid and volunteer CHWs. 38% of CHWs work in programs supported by the Health Resources and Services Administration. 30% of the organizations fund their community health workers using both a mix of federal, state, local, and private sources. 1 in 3 organizations see community health workers as a priority team member or a viable part of the healthcare workforce. There is national support and recognition of community health workers. The Patient Protection and Affordable Care Act of 2010, called the ACA for short, cites CHWs in 3 of its sections. It champions the service that community health workers provides. National support and community health worker recognition is also championed by the Centers for Disease Control, the Health and Human Services, the American Association of Diabetic Educators, the Bureau of Labor Statistics, and even the American Public Health Association, to list a few. For more information on community health workers, contact us at the Tougaloo Central Mississippi Area Health Education Center. We are located at 350 West Woodrow Wilson Drive, Suite 3320 in Jackson, Mississippi. You can reach us by phone at 601-987-9463. Our website is www.tougaloo.edu. We can be found on Facebook as well as Twitter. I thank you for your attention.